think anything of it. And then on my second growth spurt, I had choking attacks in the evenings when I was sleeping. So I would stop breathing, and those were, they got worse, I think sometime between 14, 15, 16, but, and then one time I thought I wasn't gonna breathe again. I woke up and I tried to get to my parents' room, and then I like collapsed up right in front of their door. That kind of scared me, and then after that, yeah, I thought, that's basically
From
the main one, yeah. That
And
I
then
think
it was
weird.
completely gone during
And
college?
then that, well, also for the obstructive sleep apnea, which is when, I think, you know.
So any other traumas, anything else you can relate to why you have these symptoms?
I mean, I played football in high school, and so I had 2 concussions, and then
College?
yeah, not college, in high school. No real concussions in college.
So, what you have is blood pressure problems. Can you tell when your blood pressure gets worse, when it gets better? Do you get a sense of that in your?
I feel like pressure here.
So you always feel pressure in your ribcage, and you feel it right now.
A little bit.
Close your eyes, tell me about it. Just explain it to me. How deep it is.
It's probably like a third in. It's more in the front. And
More
it's a
in
little
the
bit.
front? Can you feel it coming from the back? Keep your eyes closed. Okay, does it have a shape? If you could see the tightness, what shape would it be? Is it three-dimensional or is it a flat shape?
It's a shape. It's kind of curvilinear and like a little rotated.
It's a little rotated.
Yeah.
But if it's a shape, would it be a shape of a heart? Would it be a shape of a basketball? Would it be a shape of a Martian vehicle? What kind of shape is it?
Almost feels like a hand. Like,
A hand, okay, so it's curved.
right.
So the upper part to the lower part, you can almost feel the shape of it there, right?
Yes.
Now, where's the most intense sensation? The upper part of the hand? Right there. Is there a color that you could associate with that? Black, red. That's a very interesting color. And how about down under the fingertips? What color is it down there?
More like a red.
Red, red. And how about up by the wrist?
Here?
Yep.
Green.
Green, so that's a good one. So it really gets very intense at the curve. Now, when you feel that sensation of tightness, does it feel like that it has a pulsation to it or anything unusual, or is it just a constant sensation?
Feels like a constant sensation. It doesn't tighten with my heart. You know, it feels like it blocks the heart.
Okay, so it's a constant.
Yeah.
And as far as its depth goes, with the color black-red, is it more black-red at the front of the hand towards your front of your body, or more intense towards the back of your body? More in the front of your body. Now, if you came in from the back of your spine, could you find a place where you find that same sensation? Or do you have to come in from the front to find it?
Like, you mean if I were just
Yeah, if you were bringing your awareness from
to
the
go
back
to
to
feel the
front.
backside of it?
Yeah. Can you feel the backside of it? Or is it really more dominant in front?
I could feel the backside of it. It's definitely more anterior.
Okay, and if the volume of the tightness that you feel could fill a bucket when it's at its worst, so the very worst would fill a bucket with the sensation, how much of that bucket is filled right now?
About 8, 7 of
8 of the 10, you mean?
Yeah, that's right.
So it's still fairly strong right now, even though it's not as bad as it gets sometimes.
Oh, so you're saying the worst I've ever felt?
Yep, would be a
Would be a
full
10.
bucket.
Okay.
Be a 10.
Then, okay. There's probably like a 6.
Okay. Now, the process you saw me take him through here is a very important process for somebody like him that can't explain it. And if you can get them to see a shape, a color, a sensation, not just describing it as tight, but to really have it in dimension, it really changes it. He now knows his symptoms better than he's ever known them before because he's never analyzed them in that way. So I take a lot of individuals through that process. I don't teach it anywhere. I teach it in the fellowship often. But this is something that I've used many times in the past to help him to become more aware. Now I can talk to him about a red-black as I treat him. A black-red. A black-red. And it's very definitive to him. And someone who really can get in connection with it, there's always a color, there's always a shape. Everything that we have in our body that doesn't feel right has dimension to it. And he now has that, so we can now analyze where he goes from there. Okay. I'm going to start out, I want to check your vagus nerves, check your carotid sinus, and check a few things in the neck. Okay, so we're going to start at the bottom. I don't want to go straight to the heart where his sensations are, because the minute I treat here, I'm going to change things, and we won't know then the impact of treating away from it. So I don't go after the problem usually when I'm treating like this. I go directly to other areas that I think might impact it, because if they impact it, he'll be able to feel a change. But I go in there and try to move his heart, and move in these areas here, and I make a change, then everything else I do won't be able to give me that information as to are they involved. So go ahead and lie on your back. And I can't talk to you all about everything I'm doing, because right now it's about Justin. Why did I choose to treat Justin? First of all, this I think is just such a fascinating case for all of you to see. It gives me an opportunity to show things I never show in classes. We have no classes. I teach a lot of this stuff. And it gives us the opportunity for me to try to help him without him having to become a steamboat or anything at this point, because I don't think that his symptoms are easily solved. Where I've recommended he goes is to go see Gail Wexler. She's brilliant in these kind of areas. She teaches the Baral courses. She actually organized the American Baral, and I would highly recommend that he see her. She's booked out about 6 months, so I think he needs to get his appointment now because he probably won't get it until spring, even using my name. First thing, an acupuncture at the wrist will take a look at 4 places of the pulse. And somebody who has a strong pulse, you feel the pulse underneath all 4 fingers. When they have a weak pulse, you'll only feel it under one or hardly at all a pulse. So you want to see a good, vibrant, strong pulse. So we've done this already on him, gone in on his carotid artery. And on his right side here, all 3 fingers lift up, very strong, very vibrant pulse. This is what you want to feel as a pulse. Okay? It's got breadth, it's got depth, it's got everything. Now there's no evidence based behind this stuff. But I got to tell you, consistently with people with dizziness, nausea, autonomic issues, you'll feel a change between the 2 sides, and I use it as one of my evaluations. This side's much harder to even find the artery on. Have you found that as you've been feeling it yourself? I tell you, sometimes when these guys on TV try to see if somebody's dead or not, it's amazing how fast they can find it and how sometimes it's hard for me to find it. There it is. Only lifts up my first finger, the rest of them it doesn't lift up. Much more diminished his pulse on this side. So that might be an indicator as to what he goes. He started out with dizziness, and when his symptoms first really began, you've had, what, 2 years now of the tightness in your chest?
Yeah.
And your blood pressure was identified how long ago?
July.
In July, so it's been since July, but he's had a lot of the symptoms related to it.
I had one previous March. It was a little elevated, but
So I want to go in and see the mobility of his vagus nerve first. The vagus nerve being medial here. You can find it on front. I'm actually going to go on his right side. I expect it to be efficient, normal over here, so I get a chance to feel his other side. His vagus nerve here is nice and slippery, it moves back and forth. Scoot up off the table, stand up over here. So I've got my fingers on his vagus nerve, relax. And as I extend, it moves very smoothly over the area. So there's no interference of his vagus nerve as I go through here. Runs right next to the carotid artery. Come to the other side where I may need his help again to show me where his artery's at. I'm going to move in. There's the artery. Move the artery, come under medially. And there's his vagus nerve. And it is more tender. A lot of tenderness. Very tight. And gets very taut. So I know the vagus nerve on this side is impacted. It doesn't glide as it should. First of all, I feel over this C4, 5 area that it's adhered. So I'm going to work on its adherence there first. So now we're going to go in, I'm going medial collateral, putting pressure on it. And if anything starts increasing, you're feeling worse, you stop it, okay? Tuck the chin, let go, tuck your chin. I'm working on the vagus, what I believe is the vagus nerve, mobilizing it from medial to lateral. And what I'd like you to do, if you could, is to make me a DVD of this, if you could, so that I can get it for my fellows, because we just don't get this many times to have fellowship
Move in
videos.
closer.
My fellows have over 200 videos of me doing treatments and doing in-services and stuff that they get to watch as part of their fellowship. Because there's a lot of cases you don't get to see in a year. There we go. Now let's see if it goes as tight. Not at all. At the end here, I can still feel tightness. Feels as if it's being pulled this direction. Okay? Now, tell me about your fist, your hand. Same?
It's a little less.
Little less. Could be lying down though.
Less here. Still
Right there.
like that.
But does it all usually lessen when you lie down? You don't remember. It'd be a good thing for me to know. Now I'm going to go on the vagus nerve. I'm grabbing it. Now I'm going to extend his head back. Right there, there's a lot of tension that feels like it goes down into the rib cage. So I'm going to take him to that point of tension and then try to do a distraction. But in combination, I'm going to go in here and hold his heart down so that I can lift up on the nerve right there. Right there. Huh? Chin tuck. Yeah. Now I've got the two ends on traction. And the vagus nerve should be sliding superiorly right now, and it's not. So I think this is what he gets when he does his extension towards the left, is he's got a tightness on his vagus nerve. The problem's going to be is that I'm going to treat more than I probably should in an individual treatment on him. And so, Justin, are you comfortable with that if you have a negative reaction later?
Yes.
Because I'll stop at any point if you want me to. Oh, it's starting to let go. The heart's starting to get softer. The vagus nerve's starting to move better. Good. Deep breath. Get back on the nerve. And look at that. Much better mobility. So again, I'm going to do that oscillation, just to oscillate it at this point, so that I'm trying to pull on the nerve and get it to move through the cavity, because I can't get in there and mobilize it in there directly.
Less.
Less.
Still.
Still right there.
Like right.
Right there.
Much.
So those of you that came in later, he's identified where he feels it, and it's a shape of a hand, the tightness in his rib cage.
More red.
More
Less
red.
black.
Now I'm going to go on to the carotid. I'm going to feel the carotid artery again, see if our pulse is better. Holy mackerel. I've got a full-fledged pulse now under all three fingers. It's a really good sign. Carotid artery, remember you have a carotid sinus at around C4? That's where all of his blood pressure and everything else is mediated. In fact, in some of the articles I've read recently, they're going in on carotid sinuses and doing electrical stimulation to help people with blood pressure problems and other things, and getting some good results. I just go in and I can feel where it's at. Here's where his carotid sinus is. Not particularly tender, so it's usually very tender on somebody that it's a major problem, but it's really restricted. Can you feel how tight that is? And so I'm now just going to nudge that area and see what I can do to mobilize on the sinus, right there. The pulse is coming right through my finger. I can feel it here. He's breathing. He's getting a little glassy-eyed. I'm going to really watch it. He's getting glassier-eyed. I'm going to back off. You okay?
Yeah.
I'm just waiting for the eyes to get less glassy. Okay. Now I'm going to go back on it again. So I use counterclockwise, no, this is clockwise. Clockwise circles on this side, counterclockwise on the other side. That seems to really help. So I'm just doing a circle work on it. There we go. Carotid sinus now is better. Let me test the blood. Much stronger. I don't know if you can feel it internally. I can find it. Hey, what's going on in here?
Just like very little bit.
Very little bit. So we know that we're going.
Stomach stuff.
Yep. So I'm going after his phrenic nerve. That's more lateral. Usually find it underneath sternocleidomastoid in this area here. So now I'm going to go in. And phrenic nerve and all these nerves, they vary in their position from person to person. If you remember doing your cadaver work, you'd always struggle on some things, and your teacher would come over and spend a lot of time, oh, here it is way out here where it's not supposed to be. We have so much variance you can't depend on it. But there's his phrenic nerve. And my goodness, here again, very tight. I'm going to check his other side. Nothing there. It's a very mobile nerve. So he's had some kind of trauma to this side of his neck. So I'm thinking also articular, that I've got to look at it, because everything's right here at that 3-4 segment in this one place. I'm going to leave the phrenic nerve till tomorrow. That's too much nerve work. Scoot back on the table. My gut just said no. Trust, you know. One of the books I'd recommend everybody reads, I've already talked about outliers, and I think that's a very important one for us all to understand, from Malcolm Gladwell. Blink is the one on intuition. We're going to talk about it tomorrow. Intuition, our tacit knowledge. What's the word he uses in the book for the knowledge? It's called, I can't come up with the word. I am now going to show you, because he's got a significant restriction of his 4-on-3 vertebra and his fasciculum on his left side. So you get to see a resistance-enhanced manipulation. Passive manipulation should be right here. That's a passive manipulation. I hard to localize. But what I'm going to do now is to keep an eye on his eyes, make sure he doesn't be having any increase. And I'm going to say, gently keep it here, don't let me move your head. So I do a hold until I feel him engage right to there. There's his engagement. And then I can do my manip. There we go. Then we go and say, keep it here, don't let me move you. Now we re-educate him in the new range we just gained. So that's a resistance-enhanced manipulation. So he's doing a contraction at the same time we add our manipulation. Anybody that uses contractions out there does a contraction relaxation and then manip. Did you feel like how you were able to be in control and it wasn't as fearful? Most passive manipulations, you get a fear around it. The resistance enhanced, we just don't have patients worry about it anymore like they used to. And I have no exacerbations. I haven't had a single one. Before I developed them, I kept cleaning up for my fellows that were practicing their manipulation techniques. Patients they aggravated. It just was ridiculous how many I'd spend so much extra time treating because they aggravated them. That's when I developed this, and we haven't had a single aggravation of a cervical manip since I started teaching it this way. Okay, what do you feel now?
Just a little bit, but it's more.
Right there. Now, externally, you can see that he has compression here. He's the kind of like a sky hook. I'd like to put an eyeball here and help pull up on this. You know, we some way or another get here. Use a plunger and try to get this sternum off of his heart. Well, what? Huh? I have a plunger. I have one here too. So now what I'm going to do is just place my hand here and feel his heart. Get to know it, how it's beating, what's happening with it. His ventricle has a much stronger contraction than his atriums. Above, very strong. He's actually overworking his left ventricle. It's just really beating hard. It's the pound. It's right there. Can you feel it?
Yeah, that's the spot.
It's just pounding it. And the heart itself just doesn't feel like it's moving. You should feel a heart. You see on TV sometimes how they show the heart kind of pumping, you know, they show it inside of somebody and you see it's moving. His is pumping and it's stuck. So that gives me an idea that his heart doesn't have normal mobility. And it feels like what it's not doing is lifting up. It feels like it's drawing down. I could be wrong, but that's the way I'm going to approach it at first. Now I'm showing something here because I'm showing it to you. I don't think this is something you should play with. Okay, until you really get to know hearts well and you know how to palpate this, because I think you could aggravate somebody doing this. I could aggravate him today. But I'm really getting a chance to feel it. And it feels like his heart does not move superior. So I'm going to go in and use the heel of my hand. Find the very bottom of his heart, right there. And let my hand sink in. So every time it beats, I go in a little deeper. I'm not forcing myself in hard. Now his heart is beating right against my hand. Now I want to see, can I push that heart superior? Not at all. It won't move at all. It's stuck.
It's getting rid of that feeling of tightness.
Yep, he's getting a feeling of tightness, so I'll back off a little bit. Is that better?
Yes.
Now I'd like you to bend up your knees and you do lower trunk rotation and control the pressure you put on it. So you can control this. I'm just going to hold it. Yes. Yes. And just keep breathing and trying to let go. Try to let this really relax. Let your heart glide superior. Pillow. Thank you. Start to let go. You're doing great. Stop it at any point if you feel like you need to stop. There it goes. This could be a good reason his vagus nerve is so restricted. His phrenic nerve. The heart somehow has had a trauma here. We've seen it in a couple of our football players who get a helmet in this area. That they later on start developing problems, and it's because of the adherence. They don't get it at first. It takes a while for the bruising and everything to create adherences. There it is. There it's going. Tuck your chin out. Like that. Do you feel how the hand's moving it?
Mm-hmm.
There we go. Which one? There. That right there. Do you see? He's directing me. That's when you get to high-level patients, is when they know exactly what you need to do. Let it go. I'll give you a little break. I'm going back in. Now, let her go. There. That's it. Beautiful. Day before yesterday, I manipulated his T4 area, which is where the sympathetic chain comes from. And he got immediate reduction in symptoms, improvement in his blood pressure, but by this morning, everything had returned to the previous level. So it shows, and a manipulation affects so many things in the autonomic system, it automatically dampens things down. If it lasts, then you know that's what they needed. If it doesn't last, there. If it doesn't last, you know that the manipulation caused the dampening, but it wasn't the solution. But it tells you that it's sympathetic, and that's why I went after his vagus nerve, was because I did the test run of manipulating T4 to see if it caused a change. If it did, was it long lasting? Was not long lasting. That's clinical reasoning. That's the way we have to think when we're working with somebody, is to go after that analytical process of assessing. Okay, I just slid over his heart. Now, go ahead and take. There, now that's a bigger breath than you've had in a long time. I would have gone in and done a quick release just to get the rib cage to pop off of the heart, because I think the pericardial sac is really adhered to his rib cage. But I felt like I'd done all I should do. My gut said stop. And I've learned to really trust my gut. Every major mistake I've ever made as a therapist, I go against my gut and go for my ego, usually. Did you feel that?
Yeah.
Your voice has even changed. Okay.
That feels good.
Anything you want to say, though?
Yeah, I felt like there's just like Greg said, there's probably a little bit more.
Oh, there is.
Like that release, but I just feel relaxed, like a lot more relaxed.
Now I'm going to place my hand back. Ventricle is still beating too hard. It's still really working, but I would say it's a good 20% reduced from what it was. Before it was just lifting up my middle finger. Now it's not. It's still pretty strong right there. That's where the center of the beat is. That's the area where he feels.
Yep.
And that's where his ventricle is. How was that, huh? You got a blue light special. Got to see something that I've been wanting to see if we couldn't help him. These kind of symptoms, there aren't many people out there who know how to do it. And guess what the doctors want to do? Pharmacology. And they could help him with pharmacology, but it's treating the symptoms, not the source. You know, where I'm after, what's the source of it? Don't just treat symptoms, find out the source. That's why I don't chase symptoms with patients. Try to find out why they have those symptoms.
Can you check the pharynx, see if it moves, or?
Yeah, it's still
Okay.
phrenic nerve still tight. Okay. Let's watch your eyes as you come up. Anytime you do any work that can get in this, don't let a patient get up without you being right there, because they can have a drop in back immediately. Eyes aren't twittering, I'm not too concerned. And later I may actually use him as my vestibular demo. We'll see what we find. It's something I'm going to have to really cut back on the time frame of the vestibular, but at least you have a sense. How do you feel now?
Great.
Go back to your blood
Yeah.
pressure after we present the next section, okay? Thank you. You're welcome.